40-year-old woman comes to the office due to increasing fatigue and weight gain despite decreased food intake. Lab evaluation shows high serum TSH, low T3 and T4 levels. The patient asked to try a T3 supplementation. Administering this therapy would most likely result in which of the following hormone level changes in this patient. Now, this patient is presenting with symptoms of hypothyroidism. We know this from her symptoms of weight gain and fatigue, as well as her high TSH and low of T3 and low of T4. Now, she asks to try a T3 supplementation. So, if we were to prescribe this to her and if she were to take it, what would happen to her TSH, T3, reverse T3, and T4? Now, let's go back to the hypothalamic pituitary thyroid axis. Now, the hypothalamus is going to release TRH, which is then going to go to the anterior pituitary to produce TSH, which is then going to stimulate the thyroid gland into releasing T4 and T3. Now, most of the T3 that we're going to have is actually not going to be produced by the thyroid gland, but it is actually going to be coming from the peripheral deiodination of T4 to T3. And T3 is going to be the most active form of the thyroid hormone, and it is going to be what is causing the physiological effects of the thyroid hormone. Now, reverse T3 is going to be an inactive form of T4, which is going to happen in the periphery. So, all of the RT3 that is going to be present is going to be coming from T4, so not from T3. And this is important to understand in order to answer the question. Now, circulating T3 and T4 are going to have a negative feedback to the hypothalamus and the anterior pituitary. So we're going to have a low secretion of TSH if the patient were to take T3. If the patient were to take T3, we'll have high T3 levels. And if we have high T3 levels, since we have a negative inhibition of the anterior pituitary, and since we have a lower amount of TSH, we will ultimately get a decrease in the production of T4. And so if we have a decrease in the production of T4, then we will generate less reverse T3. And so the arrows that we've drawn is going to be consistent with, let's see, so TSH we said was going to decrease, so we can rule out answer choice A and then B. T3 is going to increase because the patient would be taking a T3 supplement. The reverse T3 would decrease because we will have ultimately a decrease in T4. So the answer will be answer choice D.